Hey everybody, it's Dr. Cameron Dennis here. Let's get started on lesson 4. So this is about shin splints. So it's also known as medial tibial stress syndrome. You can have it either anterior or posterior to the tibia, and we'll talk about that. But you'll see here shin pain along the tibia, which is the bone on the medial lower leg, the shin bone. And typically it's more widespread than just like one pinpoint area. Not always, but in general, it's going to be a larger area of discomfort than, for example, a stress fracture, which is, these are commonly confused and misdiagnosed. So we'll talk about the difference in those as we go. So symptoms, pain along the shin bone in the tibia, either in front of the bone, which is referred to as anterior shin splints, or on the back side, which is referred to as posterior shin splints. And it's sort of hard to, a lot of runners feel like they can't really explain where the pain is. It just feels like it's behind the shin, but there are muscles that attach back there. So typically worse with running, and especially running fast. So this is different from a stress fracture, which is typically very localized. A stress fracture typically hurts more when you're placing weight through your leg. So when you're standing or just walking, a stress fracture may be painful. Typically shin splints, and I would say 90% of the time, are only painful when you're running or running quickly. Unless, of course, it gets to the point where it's been like that for a long time and you didn't treat it, you maybe tried to treat it, but maybe it didn't go away and it just kept getting worse and worse. So severe cases can probably hurt when you have shin splints when you're just walking. But in general, just standing should not be causing shin splint pain. So another way you can kind of determine if it's shin splints versus a stress fracture in the tibia is that if it's a stress fracture, it'll hurt when you're just standing. But if it's the shin splints, it'll typically hurt more when you raise your toes upwards, because that requires action of the gastrocnemius or the soleus muscles, which pull on the tibia on that painful insertion place. So that is how you can differentiate between the two. So commonly caused by doing too much too soon. Limited rest or increasing mileage or intensity too quickly. Scientists are still not 100% sure what's going on to cause this. And you'll find that this is the case for many of the running injuries, and not just running injuries, but injuries, chronic injuries in general. They're not 100% sure what's actually going on. So same goes with tendonitis and tendinopathy, and we'll talk more about that in future videos. But in general, we believe it's due to irritation of the connective tissue, which from lack of adaptation to an activity, such as running or jumping. So it's a lot of fancy words, but it basically means that the area becomes inflamed because you did too much too soon. So common treatments, it really depends on what is the cause, but I would say if it's something that's bothering you, you might start with doing light range of motion exercises, like pointing your toes up and down to the side, side to side like this, drawing the alphabet. So this would be like a B, C. So you do that with your foot, trying not to move the hip, just the toes and the foot. Okay, and the ankle, I should say. So ice painful area throughout the day. So if it's obviously if it's in the front of the tibia, it's going to be a little bit easier for you to ice than if it's posterior. You might try doing a little bit of massage to that area. Don't go crazy, but you might try rubbing it a little bit. Sometimes that seems to help. I would still suggest ice and elevate after doing a run, especially if you're having shin splints. So consider cross-training during recovery. So cycling, getting on a bike, or swimming, or activities, other exercises that that don't cause you pain. So progress to barefoot foot and ankle strengthening exercises. So doing these strengthening exercises without wearing shoes, basically, is what I mean. So calf raises, when you don't have your shoes on, it brings it allows for more action and more activity of the foot muscles when you're not wearing shoes. So squats, deadlifts, and lunges. So you slowly progress into doing more and more complex lifts and exercises. Okay, start with light weights and slowly increase weights as tolerated, following rules on the next page. So we'll talk about that in the next slide. So SMART, walk to run, and strength training progressions. So the walk to run program I sent you, and the strength training progressions we'll talk about. Oh, we didn't. I don't think I talked about it. Oh, here it is. I think it was mostly in general, but we can talk about SMART progressions as well. So after getting the pain down to a tolerable level, try to slowly incorporate jogging into your walking program. If the pain increases to a 6 out of 10 or greater during the activity, back off a little bit. If the pain is increased by your workout and remains increased for over 24 hours, it's likely that you did too much. As far as progressions go, let's hold off on that until we get to module, I believe it's module 4, when we go into common strength training exercises, because then I'll go through the progressions of each one of these exercises, and I can actually show you what they are, as opposed to me just spouting off names of exercises. So when to seek medical attention, when the pain is severe with normal daily activities, when it limits your ability to walk, and if there's no improvement in symptoms despite trying everything in this presentation. When you're looking for a PT, make sure you do your research, make sure they're well trained and working with runners. It's especially important as you start to progress back to running, because a lot of times injuries can reappear if you do not fix the problem, the original cause of these injuries. So if you cannot find a PT in your area, please, a PT that meets your needs, reach out to us either on Facebook or our website, or other trusted running sources online that may be able to guide you and help you out with finding a PT or give you some sort of guidance in your return to running. So hopefully that made sense. If you have any other further questions about shin splints, please reach out, and I will see you in the next one. Thanks.